They approached us several years ago about cancer screening in our region because part of their mandate was making sure that anyone had access to cancer screening, whether they had a family doctor or nurse practitioner or not. So we started cervical cancer screening programs called Papapalooza. So we've been doing them for 3 years now. Over 200 women have been seen to get their cervical cancer screens done. But it's also been an opportunity for us to say, what other cancer screening might you need? Do you need a mammogram? Do you need a colon cancer screen? And it's also an opportunity for us to say, this is how we can get primary care in the region. One of my personal interests and projects is teaching around perimenopause and menopause. So through the OHT, we received some funding to do presentations. So I've done a series of presentations both for the public, but also for primary care providers to make sure that they've got the best up-to-date evidence-based information for them to be able to provide perimenopause and menopause care for their patients.
The Ontario Health Team has been pivotal in promoting chronic care disease management, and as part of that mandate is to provide increased care for several of the chronic diseases such as diabetes, congestive heart failure, and COPD. And they've been very supportive of our efforts to start a heart failure clinic and are providing resources to allow us to do that. This clinic allows expert care in a team-based setting with both a nurse and a cardiologist specialist involved in the care. And the Ontario Health Team has been pivotal in allowing us to grow that and providing funding for getting it started and off the ground. So the Ontario Health Team has also been very supportive in expanding our digital reach. All of the physicians are using the same electronic record. We have electronic connection to online appointment booking. And so through our websites, they're able to access the physician that they are belong to. And through a system called Ocean, they're able to make an electronic appointment. Additionally, that system also allows electronic communication. And so the physician can email the patient under a secure system information about the results of the tests or communicate with them about a change in medication. And the patients really appreciate the quick turnover and the access electronically. And finally, Ocean e-referral is an electronic referring system that is embedded in the EMR. And that allows the providers to make a referral request for a CT scan in the hospital or for a referral to an endocrinologist in a city outside of our local catchment area where endocrinology is not available. And that referral request is electronically captured and sent to that referring specialist. But also the patients are part of that triangle, and they receive electronic notification of the referral being started. And when the referral date is set, they also receive electronic notification of that time. So it's available to them, and it can be accessed at any time if they've forgotten that it's 3 months down the road and haven't put it on their fridge.
It's a collaboration between the specialized geriatric services, the family health team, and what it has done for the community is it has allowed for specialized geriatric services to happen closer to home, and it has brought a geriatrician to the region that has been able to reduce wait lists and mean that people locally do not have to travel to get the specialized geriatric services that they need. This is significant if you think about the people in our community that are elderly and traveling and the burden of traveling and getting that care. This is a really important service to have closer to home, and I think it's something that we should be exceedingly proud of.
We've, with our 211 helpline, the OHT has designed a referral program. So physicians, when they're meeting with a patient and their lack of resources, they can make a referral through Ocean, which is an online booking and referral program. And our navigators receive that referral, and then we contact the patient and help them get connected to the services that they need in the community. If there are services in the community, that referral to 211 will find those resources and help the patients and the clients access them.
It's amazing what we have been able to accomplish as a group of people coming together, like a coalition of the willing, we'll say, to come together to make this happen.
During the pandemic, there was such a massive move of people up to our region. So there's a very large portion of people whose family doctor is 2-3+ hours away, or they lost that access when they came and moved to our region. So as a specialist, my referrals were coming from everywhere of people moving up. So to have access to Shoreline, when I have patients being like, I'm desperately trying to find a family doctor, I'm like, this is a wonderful resource. It's been great from my perspective doing my obstetrics care that I have a lot of pregnant women who don't have a local family doctor, and pretty soon they're about to have a newborn baby. And so this has been a great resource to be able to send them to the Shoreline Clinic, knowing that they and their babies are going to get care until they can be kind of packaged up and organized to join another family doctor in the region. So it's been so helpful to finally have a resource for that. And for me, especially with our pregnant women and our new babies coming who didn't have any other access to care in the region.